ఎవరిలో గ్రాఫ్టింగ్ అవసరం పడుతుంది?
Wherever you have a loss of skin.
Fourth degree burns అయిన patient will they survive again?
See, fourth degree, especially if there is percentage is less.
So what are the first 60 minutes after a burn injury? What should a family do? And what are they probably doing wrong right now? తెలియకుండా చేస్తుంటారు.
నేను ఇంతకుముందు చెప్పినట్టు నెవర్ ప్యానిక్.
When science meets artistry, transformation happens. Not just in appearance, but in confidence. Hi, this is Dr. Manasa Reddy. Today we have Dr. Amar Raghu, consultant plastic, cosmetic and reconstructive surgeon. Let's welcome him. Thank you for joining us, sir. How are you?
Fine, madam.
Skin grafting sounds straightforward. So take skin from one place, put it into another. What do patients not understand about how complex this actually is?
So usually skin grafting is a very common procedure done by plastic surgeons. So usually the requirement of the skin. And first thing is we need to assess the wound. So how better is the wound? Is it infection free? Is the blood supply good? Because the bed of the wound, what we call, where we do a grafting and place the skin graft. సో ఈ బెడ్ అనేది బ్లడ్ సప్లై బాగుందా, ఇన్ఫెక్షన్ ఫ్రీ ఉందా అనేది వన్స్ వీ నీడ్ టు అసెస్ క్లినికలీ అండ్ డయాగ్నోస్టిక్లీ. సో వీ నీడ్ టు టేక్ ఎ wound cultures, see whether is there any bacterial contamination or treat the bacterial. And once it is there, then once the wound is clean and it requires skin grafting, then how to take the skin graft also there is lot of things. So we have like split thickness grafting, partial thickness grafting, full thickness grafting and epidermal grafting. There are different types of grafts. So these grafts, which type of graft to use depends upon the wound and how better we give the function and also the cosmesis. So appearance also.
The location kuda.
Yeah, even the location. So if you use a very thick graft, it won't take up. Take up means it won't be completely sticking onto the wound. It may go also.
Okay.
So where are the areas where we need to do a full thickness graft, the areas where we need to do a partial or split thickness, that is what we have by skill and experience. And based on that we need to choose. And especially children, if there are very small wounds, we usually use a full thickness graft.
Okay.
So we take complete the two layers, that is the epidermis and the dermal layer of the graft skin. If suppose if it is a very granulated good wound which is ready to heal, we take a thin split thickness graft, what we call. These are all what I am specifically telling is the thickness. So if you take a thin graft, it will heal early and will be very good. But the disadvantage is the contracture, means it will reduce early and it will pull the tissue surrounding more. So what we call the primary contracture.
Okay.
If you take a thicker graft, it contains more of dermal components, dermis, so it will contract less and appearance will be good.
Okay.
But the disadvantage of taking a thick graft will be the that is accepting the bed area will be less.
Okay.
So based on these differences we need to choose.
So ఎవరిలో గ్రాఫ్టింగ్ అవసరం పడుతుంది?
Wherever you have a loss of skin, only the skin. If suppose if the skin and subcutaneous, we have usually 4 layers. The skin, the fat layer, what we call subcutaneous fat, and muscle and bone. So if you don't have the skin layer or a fat layer, once the wound granulates and the tissue is red, what we call in layman terms red granulated, then it will accept a graft, skin graft. If suppose if it is a deep wound where the bone is exposed, there we can't use a graft. We need to use a flap.
Okay.
So flap is a vascularized tissue wherein you transfer a tissue with blood supply. Skin graft doesn't have a blood supply. It takes blood supply from where you give.
Okay.
So from the bed it takes the blood supply.
So in your experience, what is that a complex reconstructive surgery you have done?
There are a lot of complex surgeries what we deal day to day, madam. So apart from all these, we find very tough and very difficult complex reconstructions. Especially I dealt with a case of acid burns. So he was a employee in a pharmaceutical company, a young adult around 20 to 30-year-old. He had an assault due to acid. So it was attack on the face and the head and the neck. So he was in a very life-threatening condition where we had to deal, and not only myself, we deal with a team. So not only myself, we deal with the ICU specialists and myself, and also we had to involve a neurosurgeon also. Why? Because he had a previous neurosurgical operation for the head, wherein he had an implant, like a titanium mesh implant on the scalp. So due to the burns, which was very third degree burns, it was got exposed. So we had to remove that implant, reconstruct the head and reconstruct the face. And unfortunately, he had one eye blindness because of that acid attack. And later on, we involved the ophthalmologist, wherein they did a corneal transplant. And we could save his life, and also we could give a good, at least a living life. Quality of life we had to improve. And I think that was one of a big challenge for me. And apart from it, I treated one case of vascular malformation. So vascular malformation, in the sense, they are tumors with vessels. So it may be arteries, it may be veins, or it may be combined with arterial venous malformation. So he had this arteriovenous malformation, that is a tumor of the vessels involving the cheek. So it was rapidly increasing in size and was very difficult to do surgically. So I myself, and I involved even a interventional radiologist. So interventional radiologists, what they do primarily is they block these arteries by embolization. So they do this embolization so that the size of the tumor will reduce. So once the size of the tumor is reduced by blocking the arteries, then we go surgically, and we need to remove the complete tumor. Because if we try to retain even some amount, again it may recur, it may regrow also. So in that way, it was a very difficult and challenging case. And luckily, he is also a young adult patient, and we had to completely remove the tumor. And apart from removing the tumor in the cheek, he was more worried about his appearance. Because once we remove it, there will be a lot of disfigurement, what his concern. So we could address his concerns, and we could give him a good near normal shape. And there was no much deformity of this face.
We do microsurgery, Anna. What exactly is it?
Yeah. Usually microsurgery మెయిన్గా మనకు ఆర్టరీస్ వెయిన్స్ నర్వ్స్ రిపేర్ కోసం వీ డూ ఇట్. సో మైక్రోసర్జరీ ఇన్ ద సెన్స్ ఈజ్ వీ డూ అండర్ మ్యాగ్నిఫికేషన్. సో అండర్ మైక్రోస్కోప్ ఆర్ ఎ లూప్. Loop means a glass where it has a magnified lens. So loop or glasses what we wear, it will have around 4.5x what we call the magnification. So 4.5 times the magnification. If you use in a microscope, it will be 100 times. So usually we join vessels wherein they are cut by either injuries or accidents, or sometimes in oncology, like in tumors. Once we resect the tumor by oncologists, we need to take a tissue from other area of the body and take along with the blood vessels, what we call free tissue transfer, what we call. So along with the blood vessels, we take from other part of the body and bring it back to the where we remove the tumor and join with the native blood vessels. So that involves microsurgery. Sometimes nerves are cut. So nerves are cut, it's very difficult to join a nerve to nerve. So they have lot of layers, epineurium, perineurium, endoneurium. So layer wise we have to repair a nerve. So all this will come under microsurgery. So under a magnification, we have to precisely do all this repair and reconstruction.
So post-cancer reconstruction, mastectomy, jaw, tongue, limb, how much function and appearance can you truly restore?
So usually head and neck tumors, we do lot of reconstruction. So cancer procedures wherein we remove a tumor from the jaw. So lower jaw, suppose we take a lower jaw, we remove the tumor. It has the muscle, it has a skin, it may involve the bone also. So if all these three are removed, what we call composite resection.
Okay.
So the tumor involves the bone, the muscle and the skin. All these three tissues what we remove has to be replaced. So what we do, we take it from a leg. Especially leg lo, what we do is we take from the leg a small bone will be there, fibula. There are two bones, one is a bigger bone, tibia, and the other one is a fibula. From the fibula we take a part of the fibula bone, along with it we take a skin paddle, what we call the skin, and also the adjoining muscle. So that we will reconstruct all the component reconstruction, what we call. We take a muscle, bone and skin to reconstruct and replace what we have removed, especially in the jaw. In mastectomy, wherein we remove the breast tissue and sometimes if deeper involvement, we go even chest wall involving the muscles also, we do reconstruct primarily, immediately also, or secondarily. So primarily we do muscle reconstruction by taking another muscle like latissimus muscle, dorsi muscle గానీ లేదంటే abdomen muscle ఉంటుంది, rectus abdominis muscle గానీ, and also we give a cover with the skin paddle. Sometimes if the volume of muscle we take, it is little deficient, we also use an implant, what we call silicone implant. So in mastectomy, these are the reconstructions what we do. And suppose limb, especially lower limb, that is the leg. Suppose if there is lot of trauma, there is loss of tissue, muscle, bone, everything, we take from other areas like opposite leg and transfer it along with the vessels and nerve also, because we need to give the blood supply and also the sensation. So along with vessels and nerves, we take, transfer and join with the native vessels, what we call the recipient vessels, and do. All these are part and parcel of limb salvage surgeries and also coming onto onco reconstruction surgeries, oncoplastic surgery.
పేషెంట్ అటెండర్స్ కానీ పేషెంట్స్ కానీ డూ దే ఆస్క్ సచ్ క్వశ్చన్స్, ఎందుకంటే అది జనరల్గా ఎవరికైనా ఉంటుంది. వన్స్ యూ టేక్ సంథింగ్ ఫ్రమ్ యువర్ లెగ్, ఎక్కడి నుంచైనా తీసుకొని ఆ పార్ట్కి ఏమైపోతుంది, సో హౌ డూ యూ కవర్ దాట్ పార్ట్ అనే క్వశ్చన్ ఉంటుంది కదా.
So before going for surgery, there will be lot of counseling, madam. So we counsel the patient, we counsel the attenders also, because everything we should do a good counseling only, then only they'll be willing. So especially tumors, head and neck tumors gaani, breast tumors gaani, wherein we remove the part of the thing. So once the tumor is resected, how you need to replace it, that we have to clearly explain in layman terms. వాళ్ళకి ఎలా అర్థమవుతుందో అది చెప్పి, and once we are taking so and so muscle, we are saying taking so and so skin గానీ, అక్కడ కొంత డిఫార్మిటీ రావచ్చు, బట్ ఫంక్షన్ వైజ్ దే వోంట్ బి మచ్ ఆఫ్ ఫంక్షనల్ లాస్. సో ఒక కాలులో మనం ఏదైనా బోన్, పార్ట్ ఆఫ్ బోన్ తీసుకుంటున్నామంటే అక్కడ మళ్ళీ ఏం డెఫిసిట్ రాకూడదు, ఫంక్షనల్ డెఫిసిట్ రాకూడదు, అండ్ హిస్ డే టు డే యాక్టివిటీ షుడ్ నాట్ బి హ్యాంపర్డ్. సో అవి ఏం ప్రాబ్లం రాకుండా అది సేవ్ చేస్తూ, అండ్ ఇక్కడ రీకన్స్ట్రక్షన్ చేయడానికి మనం వాడే టిష్యూ కూడా ప్రాపర్గా మనం రీకన్స్ట్రక్ట్ చేయాలి. సో ఈ రెండింటిని బ్యాలెన్స్ చేయాలి. సో ద మెయిన్ పార్ట్ ఈస్ కౌన్సిలింగ్. So we should make the patient and attendants understand what we are doing actually, and then only they will get convinced, or else nobody will be willing. Oka kaallo oka bone తీస్తున్నానంటే definitely వాళ్ళకి అర్థం కాదు, but we have to explain in a proper way.
So generally when a wound simply won't heal, సో ఇన్ఫెక్షన్స్, డయాబెటీస్ ఇట్లాంటివన్నీ ఉంటా ఉంటాయి, అండ్ రేడియేషన్ డ్యామేజ్ కూడా ఉంటా ఉంటుంది. సో వాట్ ఈస్ ద సర్జికల్ టూల్ కిట్ ఇట్ బ్రింగ్స్ టు బ్యాక్ నార్మల్, ఎట్లా ఉంటుంది?
Nowadays, there are a lot of cases what we see, especially diabetic ulcers or trophic ulcers, wherein there is no sensation of the foot. So foot sensation due to diabetes gani, due to other conditions, the foot becomes insensate because it doesn't have any sensation. So that a person who walks, he will have even small wounds, he won't be knowing it. So a sensation first we have to give a priority, and blood supply. So these two things, it may be local factors or a generalized factors. Generalized factors like diabetes, we should first control the sugars. And then how to improve the blood supply? There are a lot of medicines to improve the blood supply. There are a lot of procedures like vascular procedures wherein we remove the blockage of the vessels like stenosis gani or atherosclerotic gani, wherein we do stenting procedures or bypass procedures to improve the vascularity. So primarily these two things have to be addressed, sensation and blood supply. Once we improve the sensation and blood supply, the most of the ulcer will heal automatically by regular dressings. Even still, if it doesn't heal, the local factors we have to treat. Like especially if there is any infection undi ante, we have to do a surgical debridement. So we have to remove all the infective material, remove the slough, what is the dead tissue and everything. And there are certain advanced procedures wherein we can increase the oxygen content at the wound, like hyperbaric oxygen therapy అనేది ఉంది. సో hyperbaric oxygen therapy అనేది ulcers, any non-healing ulcers or very long-standing trophic ulcers, we can put in a hyperbaric chamber. So if suppose foot is ulcer is there in the foot, we put the foot in a hyperbaric chamber wherein we provide 100% oxygen so that it will reach directly to the ulcer. So oxygen, once we give a rich oxygen environment, the ulcer will heal at a faster rate. And there are certain new procedures, advanced procedures wherein stem cell therapy antam and growth factors. So usually from the patient own blood we can harvest stem cells. So these stem cells will increase the blood flow and increase the blood vessel growth into the area and also produce epithelialization. Epithelialization means it increases the growth of the tissue surrounding it. So these all factors promote healing of the wound early.
A fourth degree burns in a patient, will they survive again?
See, fourth degree, especially if there is percentage is less, they will survive. Suppose a 20% fourth degree burn, survival is better. But 50% burns, fourth degree, survival is, that is mortality will be high. Because all the muscles which are burnt, they release lot of toxins, endotoxins, they release lot of toxic material into the blood. It will cause a renal shutdown, immediate kidney failure loki veltaru. And apart from it, they have lot of pulmonary edema untadi, lung failure avutadi. So that all these organs, multi-organ dysfunction syndrome anta, MODS anta. So ఇది జరిగినప్పుడు సర్వైవల్ అనేది చాలా డిఫికల్ట్. సో దానికి ఏంటంటే వీ నీడ్ లాట్ ఆఫ్ వెంటిలేటరీ సపోర్ట్, ఐసీయూ కేర్ అండ్ వెంటిలేటరీ సపోర్ట్ కాకుండా ట్రెక్యూస్టమీ ఇవన్నీ చేసినా కానీ సర్వైవల్ అనేది ప్రజెంట్ సినారియోలో అప్ టు 50% to 60% బాడీ సర్ఫేస్ ఏరియా బర్న్స్. ఇఫ్ ఇట్ ఈస్ ఫస్ట్ అండ్ సెకండ్ డిగ్రీ, సర్వైవల్ ఈజ్ బెటర్, మార్టాలిటీ విల్ బి లెస్, మార్బిడిటీ విల్ బి మోర్. మార్బిడిటీ అంటే వాళ్ళకి కాంప్లికేషన్స్, డిఫార్మిటీస్ ఇవన్నీ ఎక్కువ ఉంటాయి, ఇన్ఫెక్షన్, సెప్సిస్ ఇవన్నీ. సో దీస్ థింగ్స్ హ్యావ్ టు బి అడ్రస్డ్.
వాట్ అబౌట్ చిల్డ్రన్? ఫోర్త్ డిగ్రీ అంటే జనరల్గా అడల్ట్స్కే కష్టం అనుకున్నప్పుడు, వాట్ అబౌట్ ద కిడ్స్?
చిల్డ్రన్ వెరీ డిఫికల్ట్, మార్టాలిటీ విల్ బి వెరీ హై. And we have to take a lot of involve the pediatricians, involve the ICU intensivists, my plastic surgeons, everybody, and try to save as much as possible. We have to put in a lot of efforts. But even then, mortality will be high in fourth degree burns, especially in children.
So what are the first 60 minutes after a burn injury? What should a family do? And what are they probably doing wrong right now? తెలియకుండా చేస్తుంటారు.
యూజువల్గా ఏంటంటే నేను ఇంతకుముందు చెప్పినట్టు నెవర్ ప్యానిక్, అండ్ ఉంటుంది యాంగ్జైటీ ఉంటుంది, అండ్ దే విల్ బి వెరీ వరీడ్, ఎస్పెషల్లీ పేరెంట్స్. చైల్డ్కి బర్న్ వచ్చిందంటే ఇమీడియట్గా ఏం చేస్తారంటే దగ్గరున్న టర్మరిక్ లేదంటే సమ్ ఆయిల్, సమ్ బటర్, సంథింగ్ దే విల్ అప్లైడ్. నెవర్ డూ ఇట్. సో ఫస్ట్ థింగ్. అండ్ దెర్ ఆర్ 4 C's, like first cooling, and first you try to wash the suppose hand మీద burn, wash the hand with a running water. It should not be too cold. It should be normal temperature water. It should run for 15 to 20 minutes, so that once we cool that wound, the child will have relief of pain. Then clean. So the second C is cleaning of the wound. Cleaning of the wound means don't apply all native medicines or local applications or some ఏదో ఆకు పెట్టడము లేదంటే టర్మరిక్ పెట్టడం ఇవి కాకుండా యూ అప్లై అన్ యాంటీసెప్టిక్ క్రీమ్. మనకు రెడ్లీ అవైలబుల్ క్రీమ్స్ చాలా ఉన్నాయి. సిల్వర్ సల్ఫాడైజిన్ క్రీమ్ అని అంటాం, మిప్రోసిన్ క్రీమ్ అంటాం. అండ్ ఇవి అప్లై చేసేసి దెన్ కవర్ ఇట్. ద థర్డ్ ఈజ్ కవరింగ్. కవర్ చేయడం అంటే క్లీన్ టవల్ ఆర్ క్లీన్ క్లాత్ ఆర్ ఇఫ్ యూ హ్యావ్ ఎ ర్యాప్ విత్ ఎ డ్రెస్సింగ్ రోల్ అంటాము, అది ఉన్నా కానీ యూ కెన్ కవర్ ఇట్. అండ్ దెన్ కంఫర్ట్. సో మేక్ ద చైల్డ్ కంఫర్టబుల్ బై రిలీవింగ్ ద పెయిన్. సో పెయిన్ రిలీవ్ అంటే సింపుల్ పారాసిటమాల్ సిరప్. ఇఫ్ యూ గివ్ హిమ్, హీ విల్ హ్యావ్ పెయిన్ రిలీఫ్. Then you take him to a nearby clinic or a hospital for first aid. So primarily, first thing is cooling the wound and cleaning the wound, covering it, and then comfortable. So make the child comfort. This for children. Elderly or any other age group, you should do all these things, and you see if it is a very large area of burn, better to take him to a nearby hospital or clinic.
Will there be a difference ఒక నార్మల్ పేషెంట్ who has to undergo the plastic or cosmetic surgery కి అండ్ అగైన్ ఒక సెలబ్రిటీ లెవెల్ లైక్ దే హ్యావ్ టు ఎక్స్పోజ్ హీరో వాళ్ళు కానీ లేకపోతే పైలట్స్లో దీంట్లో ఉంటారు, అట్లాంటి వాళ్ళకి ఎక్స్పోజర్ వాళ్ళకి ఎట్లాంటి స్కార్ ఉండొద్దు, ఈస్థెటికల్గా చాలా బాగుండాలి. సో అట్లాంటి వాళ్ళకి ట్రీట్ చేసేటప్పుడు అండ్ నార్మల్ పేషెంట్కి ట్రీట్ చేసేటప్పుడు డిఫరెన్స్ ఉంటుందా?
There won't be any difference, madam. We don't look at apart from like that.
No, it's not like that, but the appearance, వాళ్ళకి ఒక స్కార్ ఉండొద్దు అనేసి ఉంటుంది.
So scarless healing and scarless reconstruction is one thing where we have lot of advances. See, the way we do once, the skill, the experience will count definitely, because by the years, how we suture, even a single suture will count how better you do.
True.
And how it heals. Scar anedi depends upon the surgical skill and also how the skin reacts. And what material you use, what fine material you use, and also skin reaction to the suture material or to the technique what we use. Sometimes it may react with causing a little scar, which is more visible, more conspicuous. So దానికి కూడా మనం ఇంకా we need to fade it out or we need to treat it in such a way it doesn't be appearing so awkward or anything. There are a lot of procedures. We have lasers, we have creams, ointments, and also surgical scar revisions surgically again. So especially when performing a cosmetic procedure, we should be very sure that any scar we are trying to treat it in a very proper way so that it doesn't become a problem in a later. So we should take care of all these things, use of good material, suture material, good technique, and have a good skill. And even after surgery, there is lot of things we need to take care, post-operative care. Even dressings, it should not get infected, it should not get soaked, and regular dressings, regular inspection. So patient ki kontamandi they won't be willing to come for follow-up regularly, but we should insist and we should observe regularly how it is healing. Then only we need to correct it.
After surgery follow-up kuda important.
Very, very important.
There are few things which generally people do. Butter, ice, toothpaste, raw egg white. What are the most dangerous home remedies for burns that are still common in India, and why are they so harmful?
Any this local application of raw egg gani and butter gani, usually ఏంటంటే స్కిన్ పైన once it is a burn, it will damage all the layers. Like if it is a superficial burn, it will damage the epidermal layer, and the nerves will be exposed. So it will have intense pain. So you are again applying a film or a coat which is not like viable, and it will again still cause more amount of irritant and burning pain. So never apply it. So you just to clean under a running water and apply antiseptic cream or antibiotic cream which is available at your home. Nothing more.
Okay. So, the rule of nines. How do you rapidly assess how much of body is burned? And when does a patient's situation becomes life threatening?
So, rule of 9 is a medical term where we calculate the percentage of burns. Suppose if the whole hand is burnt, we take it as 9%, means 4.5 is the front of the hand complete and 4.5 is the back of the hand.
Okay.
So, the whole hand is burnt, we take as 9% burns. If suppose the other hand also is burnt, 9 and 9, 18%. If whole of the chest and abdomen is burnt, we take it as 18 to percent burns. Even the back is also burnt, 18 plus 18, 34, 36%. So this is an approximate guide for to assess how much is the percentage of burns. Total body surface area.
Okay.
So if suppose he has both the limbs, that is hands, both the legs are burnt, we can calculate how much of the, if suppose the whole body is 100%, we take how much percentage of burns is there on his body. And apart from it, the other thing what we need to assess is the depth of the burns. Is it first degree burns, second degree, third degree, fourth degree? First degree is very superficial burns. Only the epidermal layer is burnt. And it will be red, it will be very painful.
Okay.
Second degree burns deeper with epidermis and part of dermis. That is the deep burns. Wherein you have white blanched burns, the color will be white and sensation will be lost because all the nerves will be damaged.
Okay.
So this is a second degree, and third degree is still deeper, wherein the skin is burnt and also involving the underlying fat layer and still more deep burns are fourth degree, wherein the muscle and bones also are burnt.
Okay.
Especially in electrical burns, wherein the current high voltage, especially high voltage electrical burns, the current passes deep inside and it will cause complete burning of the muscle and the bone also. So that we call fourth degree burns. Especially in adults, these are the rule of 9 what we call. సో దీని ద్వారా మనకి ఏం తెలుస్తుంది అంటే ఎంత పర్సంటేజ్ ఆఫ్ బర్న్స్ ఇన్వాల్వ్ అయ్యింది, ఎంత డెప్త్ అయింది, పర్సంటేజ్ అండ్ డిగ్రీ. చిల్డ్రన్లో ఏంటంటే వీ క్యాల్కులేట్ ఇన్ ఏ డిఫరెంట్ వే. సో చిల్డ్రన్లో ఏంటంటే బాడీ సర్ఫేస్ ఏరియా వీ హ్యావ్ టు డూ క్యాల్కులేషన్, బట్ head is a more larger area than the limbs. So head will account for 9% of burns. If head is completely burned, it comes under 9%. So that way it is different. And why we have to calculate this burn surface area means requirement of fluids. So we have to resuscitate, fluid management, ఎంత ఫ్లూయిడ్స్ కావాలి ఇమీడియట్గా, బికాస్ దే విల్ గో ఇన్ టు షాక్. సో ఈ ఫ్లూయిడ్ లాస్ ఉండడం వల్ల దే గో ఫర్ హైపోవెలిమిక్ షాక్ అంటాం. సో డీహైడ్రేషన్ ఇవన్నీ. సో ఓరల్గా ఫ్లూయిడ్స్ ఇవ్వచ్చా లేదంటే త్రూ ఐవి ఫ్లూయిడ్స్ ఇవ్వాలి అనేది ఎంత రిక్వైర్మెంట్ అనేది చిల్డ్రన్ కానీ అడల్ట్స్ కానీ క్యాల్కులేట్ చేయడానికి ఇవన్నీ యూస్ఫుల్ అవుతాయి.
So, burns in India, whether from kitchen accidents, kerosene stoves, or workplace fires, what is true scale of crisis we are not talking about?
So, especially burns, especially thermal burns, what we call flame burns. It is very high incidence, especially in India. Low socio-economic group annachu, ledante crowded areas, and especially work areas like industrial accidents. So ఈ type of scenarios లో actually there are around 1.7 to 1.8 lakh burn cases every year. And out of them the mortality, the death is also very high because they don't have proper medical facilities, early treatment, early acute burns management అనేది ఇప్పుడు దే ఆర్ లాట్ ఆఫ్ ఎవాల్వింగ్ థింగ్స్. బట్ ఈవెన్ దెన్ అక్యూట్ బర్న్స్ ట్రీట్ చేయడము, మేనేజ్ చేయడం అనేది ఇట్స్ లాట్ ఆఫ్ కాంప్లికేటెడ్ అండ్ వెరీ డిఫికల్ట్ ఆల్సో. సో దీనివల్ల మనకు ఎస్పెషలీ ప్రివెన్షన్ ఈజ్ మోర్ ఇంపార్టెంట్. సో ఎస్పెషలీ మీరు అన్నట్టు హౌస్ హోల్డ్ కిచెన్ ఏరియాస్ ఎస్పెషలీ ఇట్ షుడ్ బి మోర్ వెంటిలేటెడ్ అండ్ వీ షుడ్ ఆల్ హ్యావ్ ప్రికాషన్స్. especially even nowadays high rises, apartments, దీస్లో పైప్డ్ గ్యాస్ అంటున్నారు, సిలిండర్ గ్యాస్ అంటున్నారు. You should take lot of precautions. And also we see in lot of apartments wherein they completely remove the fire safety measures. Usually అంటే ఇంటీరియర్ డెకరేషన్ కానీ దే రిమూవ్ దిస్ ఫైర్ స్ప్రింక్లర్స్ అని ఉంటాయి. వన్స్ ఎనీ ఫైర్ యాక్సిడెంట్ ఇట్ విల్ కంప్లీట్లీ స్ప్రింకిల్ అండ్ రిమూవ్ ద బర్న్ ద ఫైర్ యాక్సిడెంట్. అవి కూడా రిమూవ్ చేస్తున్నారు, బట్ ఇట్స్ నాట్ బి డన్ లైక్ దట్. అండ్ రెగ్యులర్ ఇన్స్పెక్షన్ ఆఫ్ దిస్ గ్యాస్ ఇన్లెట్స్ కానీ అవుట్లెట్స్ కానీ ఎనీ లీకేజ్ కానీ. అపార్ట్ ఫ్రమ్ దిస్ చిల్డ్రన్లో కామనెస్ట్ కాదు ఏంటంటే దే యూజువలీ టెన్ టు గో ఇన్ టు ద కిచెన్ ఆర్ దే యాక్సిడెంట్లీ pour hot water on them, or especially cold cough వచ్చినప్పుడు they do the steaming. సో స్టీమ్ ఇన్హలేషన్ చేసేటప్పుడు చాలా డేంజరస్. అది ఓపెన్ వాటర్, హాట్ వాటర్ యాక్సిడెంట్గా పడిపోవడం, దీస్ ఆర్ అ లాట్ ఆఫ్ కామన్ కాజెస్. అపార్ట్ ఫ్రమ్ ఇట్ ఇండస్ట్రియల్ యాక్సిడెంట్స్లో ఎలక్ట్రికల్ ఇంజురీస్, ఎలక్ట్రికల్ బర్న్స్ అంటాం, అండ్ ఆల్సో యాసిడ్ బర్న్స్. ఫార్మాస్యూటికల్ ఇండస్ట్రీస్లో వీ హ్యావ్ లాట్ ఆఫ్ యాసిడ్ బర్న్స్. So these things, more of prevention, we need to educate them, especially household children or elderly people, industrial workers. We should give a lot of protective wear and also educate them.
Okay.
These are the more important things what we need to think about.
Thank you so much
Thank
for
you.
your insights.
Thank you.